Wow.
Hello, I'm Dr. Bittiker. As you know, we've been covering a series of the pauses, the ones about the type of pauses such as menopause that women have and cardiopause where the heart may cease to function. Well, instead of doing one of the pauses today, I decided to change the topics a little bit, although we'll get back to the pauses on the next presentation. But the reason I wanted to do this was I ran across some interesting statistics, and I want to run this by and show that there is something you can do about it. Some of the stuff is kind of scary. We've noticed, I mentioned this on my radio program in the last few years because I study these statistics on a daily basis all the time, and I noticed something was going on, which was that normally you'd see the usual statistics would come in from the Centers for Disease Control or other outfits such as the FDA, and they'd say how we would expect that our life expectancy would keep creeping up, and the number of heart attacks percentage-wise would decrease, and we had improvements in health, and that looked really good. We got kind of used to that. It's been going on for almost 100 years. But lately, the last 6, 7, 8 years, it hasn't been going up. Our life expectancy has not been going up. It's been going down. And some people wrote some pretty snarky articles about how the people that it was being affected by this the most deserved it. Well, that's not true. Nobody deserves to have a disease or a shortened lifespan. But there's a lot to it. And think about this, is that this is in the middle of us kicking into a whole new healthcare system, and the minute this healthcare system kicks in, we start to get a drop in longevity. Is there an association? Well, actually, yes, there is. But it's not the sole cause. There's a lot of other things going on. And what we end up with is a healthcare system here in America where we have the most expensive healthcare system in the world because it is not a healthcare system. It is a disease treatment system. It's designed to extract the maximum amount of money out of you by letting you get sick and then trying to do a miraculous cure to get you well once you get scared. Once you think, my God, I've got something really bad and I'll pay anything to get well, then you end up just about paying anything. So we have a system where it doesn't work that well. Truly the definition of insanity is continue to do the same thing you've always done, expect a different outcome. And you have so many people telling you they got the answer. That's because they're not telling you the full details of what's going on. The truth of the matter is we spend more money. The closest country to us in the world is Norway, and we spend 250% more per person on healthcare than they do. We're not even close to us, and yet they outlive us. In fact, let me give you some statistics here. I pulled this off of Natural News. This was originally from a report, the Journal of Health Affairs. The United States ranks 49th in the world in longevity. Did you get that? We're number 49, and yet we spend more money. We spend 2.5 times as much as the nearest country spends, and we spend 10 or 20 times more than a lot of the countries that outlive us spend on their health care, and yet they outlive us. And remember this, the World Health Organization did another study. The one I just quoted you was just recently, where we're 49th in the world. But the World Health Organization did a study back in 1999. At that time, we were 24th in the world in longevity. We've dropped 25 spots since then. But what happened? Well, an interesting thing is to figure out, let's see if I can pull this up, how we rank. Now, this article goes on to say something. I think it doesn't explain it correctly. They say, well, the reason we have declining healthcare and we're 49th in the world is because we don't have socialized medicine. Oh, yes, we do. We've always had it. Well, we've had it for a long, long time. In fact, we do have a type of universal health care already. You say, no, we don't. Well, yes, we do. Let me give you an example. Let's say you're a homeless person, an illegal alien, or just anybody, you or me, and you're walking around somewhere in Pasco County, you're walking in downtown Tampa, and you pass out. You think they're just going to leave your body there and let you die on the street? No. An ambulance will come by, pick you up, and take you to the hospital, and spend hundreds of thousands of dollars to get you well, and whether you pay the bill or not, you'll get that care. Which is one of the reasons why when you go to a hospital and you do have insurance or you do have a bill, that's why your bills are so astronomically high, because of the other people that went there and got treatment and didn't pay for it. In fact, the cost is shifted over to you. That's one of the reasons why hospitals charge so much for so many things that you would think they wouldn't have to charge much for, because they've had to give it away to a lot of people. That's the law. So we've had a system like that in place for a long time. But, it's not as good a healthcare system as you would want, but it is there. So we have a system. Well, let me tell you, what's interesting is that they assume that the countries around the world that outlive us have socialized medicine. That's not true. I'll give you an example of some of the countries that outlive us here. I looked up this list here. This is from the United Nations, and let me give you names of a couple countries here. Let me see. Curacao, which is a colony of the Netherlands, and Albania, Panama, Qatar, the Czech Republic, Brunei, Guam, one of our own colonies, Lebanon, let me get a couple more here, Croatia, Uruguay, Poland. Most of those countries, and there's others like French Guiana and all these, they don't have any type of healthcare system at all. Yet they outlive us. Lesotho land in Africa outlives us. How do they do this? Well, sometimes they do it on purpose, sometimes they do it by accident. My point is that not having a socialized healthcare system, that's not how you live a long time. It helps, no doubt about it. In fact, in my own practice, I've never seen a sicker population than I've seen here in the last 6 or 7 years. In fact, did you know that the percentage of the population that is disabled, claiming disability benefits, has doubled in the past 8 years? Now, it's true that probably some of those are some people kind of working or gaming the system. I get that. It happens. But most of those people are really genuinely disabled. In fact, the disability rate among people today in the 50 to 60 age range is about 20% higher than it was, say, 20 or 30 years ago. In other words, you're not as good a shape as your parents or your grandparents were at the same age, which is one of the reasons why you may not live as long as they live, because your level of disability, the amount of medications you take, and the chronic diseases you have are higher than middle-aged people had, say, 20 or 30 years ago. So our society is getting sicker, not better. And you don't do that by having a more advanced healthcare system. Again, waiting for you to have a heart attack is not a good thing to do. I believe in trying to prevent you from having a heart attack in the first place. Waiting for a child to be born with a birth defect is not a good idea. Why do you do something to try and prevent that birth defect in the first place? Well, that's some of the things that we recommend to do to our patients here, is to do what's called preventive health care. And we mean that. And we find out by looking at the increasing death rates among certain classes of people that they're linked to several behaviors. One is, surprisingly enough, did you know that one of the leading causes of death among young people is drug overdoses? Yeah, we have a drugged society. Now, you hear me sometimes on the radio program rant and rave against drugs, and the reason for it is because I've seen people destroy their lives on taking drugs that they thought were good, okay, prescribed by the doctor. How could this possibly be a bad thing? And they get hooked on it, and they start buying it on the streets, and their life spirals down, or they go from doctor to doctor. I've seen this happen to most people. In fact, it's a bit of a problem with the profession of the medical doctors themselves. Did you know that at one point in their career, 1 out of 4 medical doctors has a substance abuse problem themselves from their own medications? That's their own profession. And most of these opiates, it's not somebody making them in their garage. They are made by pharmaceuticals and somehow get into the black market. So this is an ongoing problem. And one of the reasons why we have this increase in opiate use is because of increased chronicity of pain. We have more people in pain than we've ever had before. Well, as a chiropractic doctor, I've treated pain in patients for 45 years without drugs. So there's an alternative that works very, very well. And you should seriously think about it if you have back or neck pain or any type of pain. We have everything from lasers to cold laser therapy to pulsed electromagnetic field therapy, plus chiropractic care for chronic pain. You'd be surprised how well it works, and you don't get hooked on this stuff. So what you can control, what you do and what you don't do, is going to have more profound effect on how long you're going to live and how well you're going to be than anything any doctor is going to do. I've had several patients that I treated that were over 100 years of age. And you kind of ask them, well, how'd you do this? Well, what they told me, some things, is what they didn't do was that every time there was a drug that came on the market, they didn't run out and take it. Or every time there was a new surgical technique, they didn't go down to the doctor and say, yeah, I want that surgery done on me. No, they didn't do that. It was a lot of things they didn't do and did do that is what got them to live a longer and healthier life. Well, that's what we focus on here in the clinic, and I want you to know that that's going to have a more profound effect on your health than any healthcare system. Also, with the changes that we're seeing in our healthcare system, I'm seeing many people who simply cannot use their insurance. There are some people that love Obamacare because they're not paying for it or they're getting heavily subsidized. But actually, there's more people, about 70% of the population, dislike it intensely because they're paying a much higher premium and getting much less service. I'll give you an example. I have a family, typical patients, husband, wife, 2 children. They have an income of $54,000 per year. They used to pay around $600, $700 a month for insurance, and they had about a $1,500 to $2,000 copay deductible for their insurance and maybe $10, $20 copays for each individual service. Now they're paying $1,600 a month. They have a $5,000 deductible and $80 copays. So in my own clinic, patient will come in here wanting chiropractic care. They'll have a policy that says, see, doc, I've got chiropractic care. And I go, well, I'm happy for you, but did you read the fine print? The fine print is this, is that you have an $80 copay, which means your copay is higher than anything I charge for chiropractic treatment. So you're back to a cash type transaction like it was in the 1950s, even though you have insurance. Or you see people postponing going to a doctor because they simply don't have the out-of-cash money to pay for it, out-of-pocket money to pay for it. And so that's why I'm seeing a sicker and sicker population in my own clinic, and my other doctor friends are telling me they're seeing the same thing. People are postponing care. My point is this, is that you need to take care of yourself because the government's going to tell you that they're going to take care of you and they're not going to do it. Remember, a study was done at UCLA years ago, and it showed you that for every dollar that you spend on preventative health care, saves you $12 on your